I'm Bob Greenspan and welcome back. I'm going to introduce you to several infectious diseases that still threaten us, but I'll do this through the images and the words of folks who suffered from them in the pre-antibiotic era. Prior to the invention of the microscope by Antoine van Leeuwenhoek in the 17th century, it was 200 years before Louis Pasteur and Robert Koch were able to attribute those diseases and deaths to previously invisible microorganisms. Earlier, I mentioned that there were a number of proposed explanations for the loss of life over the ages that included an imbalance of the humors, what was called a nervous irritability of the vessels, a punishment for sinful behavior, and commonly unseen poisonous vapors or miasma in the air. You are looking at a 16th century German pomander. Since the theory was that poisonous vapors carried disease, it made sense that various fragrances carried in a device like this one would be protective. Malaria was common in mosquito-infected swamps, so that's where the name for that disease originated. Malaria meaning bad air. In the past, despite not being aware of either the etiology or the person-to-person spread of infectious diseases, several methods of control were in fact quite effective, including the isolation of carriers. In 1518, the mayor of Oxford confined the ill to their houses for 40 days. The word quarantine is derived from the Italian quaranta giorni, meaning 40 days. This period of time may have been derived from the Bible, since it was 40 days that both Moses and Christ were isolated in the desert. Shakespeare seems to have had a fairly good understanding of the concept of communicable disease when, in Coriolanus Act 3, Scene 1, Brutus said the following:
"Pursue him to his house and pluck him thence, lest his infection, being of catching nature, spread further."
No infectious disease carries with it a more alarming and storied past than the Black Plague caused by Yersinia pestis, a bacterium transmitted to humans from fleas by way of infected rats. In the 6th century, more than 100 million people died as a result of the plague. Dark hemorrhages under the skin led to sepsis, gangrene, and ultimately death. Initially, black pustules developed at the site of a flea bite, and buboes, or swollen and tender lymph nodes, primarily in the inguinal and axillary areas, soon followed, from which bubonic plague got its name. These lymph glands discharge purulent, foul-smelling material. The less common but very deadly pneumonic form spread from person to person by way of the respiratory tract. Sneezing carried a bad prognosis. During the 6th century outbreak, Pope Gregory the Great began the custom of saying "God bless you" to those who sneezed, so that they might ultimately go to heaven. Those who were alone when they sneezed would say to themselves, "God help me." One of the earliest descriptions of the plague came from Rufus of Ephesus, a leading 1st century Greek physician.
"In the plague there is everything which is dreadful, and nothing of this kind is wanting as in other diseases. For there are delirium, vomitings of bile, distension of the hypochondrium, pains, much sweatings, cold of the extremities, bilious diarrheas, which are thin and flatulent, the urine watery, thin, bilious, black, having bad sediments, and the substances floating on it most unfavorable, trickling of blood from the nose, heat in the chest, tongue parched, thirst, restlessness, insomnolency, strong convulsions, and many other things which are unfavorable."
In 1347, the plague spread from Asia to Europe, likely from Caphio, where Tartars practiced the early biologic warfare of catapulting bodies of plague victims into the fortress of their enemies. Those infected, along with rats and fleas, escaped Italy with the disease, which then moved on to the rest of Europe, where in the next 3 years about 20 million people, or about 1/4 of the population of Europe, lost their lives. Italian novelist Giovanni Boccaccio wrote that those unfortunate to have contracted the Black Death, to quote him, ate lunch with their friends and dinner with their ancestors in paradise. This is a 16th century painting by Peter Bruegel the Elder called The Triumph of Death, accompanied by Boccaccio's description of that time in Italy.
I say then that the years of the beatific incarnation of the Son of God had reached the tale of 1348, when in the illustrious city of Florence, the fairest of all the cities of Italy, here made its appearance that deadly pestilence, which, whether disseminated by the influence of the celestial bodies, or sent upon us mortals by God in his just wrath by way of retribution for our iniquities, had had its origin some years before in the East, whence, after destroying an innumerable multitude of living beings, it had propagated itself without respite from place to place, and so calamitously had spread into the West. In men and women alike it first betrayed itself by the emergence of certain tumors in the groin or the armpits, some of which grew as large as a common apple, others as an egg, some more, some less, which the common folk called gavoccioli. From the two said parts of the body this deadly gavocciolo soon began to propagate and spread itself in all directions indifferently, after which the form of the malady began to change, black spots or livid making their appearance in many cases on the arm or thigh or elsewhere, now few and large, then minute and numerous. And as the gavocciolo had been and still were an infallible token of approaching death, such also were these spots on whomsoever they shewed themselves. Those not infected changed their behavior in many ways, in order to avoid a threat they could not recognize and did not understand. They therefore walked abroad, carrying in the hands flowers or fragrant herbs or divers sorts of spices, which they frequently raised to their noses, deeming it an excellent thing thus to comfort the brain with such perfumes, because the air seemed to be everywhere laden and reeking with the stench emitted by the dead and the dying and the odors of drugs. Tedious were it to recount how citizen avoided citizen, how among neighbors was scarce found any that zero wed fellow feeling for another, how kinsfolk held aloof and never met, or but rarely. Enough that this sore affliction entered so deep into the minds of men and women that in the horror thereof brother was forsaken by brother, nephew by uncle, brother by sister, and oftentimes husband by wife. Nay, what is more, and scarcely to be believed, fathers and mothers were found to abandon their own children, unattended, unvisited, to their fate, as if they had been strangers. Many died daily or nightly in the public streets. Of many others, who died at home, the departure was hardly observed by their neighbors until the stench of their putrefying bodies carried the tidings.
This familiar costume was worn by physicians presumably to protect themselves from the plague. A popular nursery rhyme is felt by many to refer to those suffering from the disease. Ring around the rosy, a pocket full of posies, ashes, ashes, we all fall down. Ring around the rosy, a maculopapular reddened area developed at the site of the flea bite, with a later rose-colored circular rash presented on the arms and legs. A pocket full of posies. Physicians believed that the disease spread by air, so they carried flowers or posies in their pockets when they treated their patients. Many dissolved these flowers in vinegar along with the powder of cloves, cinnamon, incense, and perfumed oils. This mixture was then placed in the long noses of masks they wore to protect themselves from contagion and to hide the offensive odor of death. Ashes, ashes. This might have represented either the remains of corpses burned in mass graves or the darkened skins of those infected. Agnolo de Tura personally witnessed the devastation experienced by millions in the 14th century, but we must remember that though we now have effective antibiotics, the Yersinia pestis bacterium is still claiming lives today.
Father, abandoned child, wife, husband, one brother, another, for this illness seemed to strike through the breath and sight, and so they die, and none could be found to bury the dead for money or friendship. Members of a household brought their dead to a ditch as best they could. Without priest, without divine offices, great pits were dug and piled deep with the multitude dead, and they died by the hundreds both day and night, and as soon as those ditches were filled, more were dug. And I, Agnolo di Tura, buried my 5 children with my own hands. And there were also those who were so sparsely covered with earth that the dogs dragged them forth and devoured many bodies throughout the city. There was no one who wept for any death, for all awaited death, and so many died that they all believed that it was the end of the world.
Throughout recorded history, the suffering, both mental and physical, caused by leprosy and the Mycobacterium leprae has been enormous, despite the fact that the disease is not easily contagious. Leprosy manifests itself through damage to nerves of the extremities, the skin, and the upper respiratory tract. It was first referenced as early as 2400 BC in the Egyptian Ebers Papyrus. The diagnosis of leprosy and the isolation of lepers is also outlined in the Bible in Leviticus 13.
Then the Lord spoke to Moses and to Aaron, saying, when a man has on the skin of his body a swelling or a scab or bright spot, and it becomes an infection of leprosy on the skin of his body, then he shall be brought to Aaron the priest or to one of his sons the priests. The priest shall look at him on the 7th day, and if in his eyes the infection has not changed and the infection has not spread on the skin, then the priest shall isolate him for 7 more days. The priest shall look at him again on the 7th day, and if the infection has faded and the mark has not spread on the skin, then the priest shall pronounce him clean. It is only a scab, and he shall wash his clothes and be clean. But if the scab spreads farther on the skin after he has shown himself to the priest for his cleansing, he shall appear again to the priest. The priest shall look, and if the scab has spread on the skin, then the priest shall pronounce him unclean. It is leprosy. As for the leper who has the infection, his clothes shall be torn and the hair on his head shall be uncovered, and he shall cover his mustache and cry, unclean, unclean. He shall remain unclean all the days during which he has infection. He is unclean. He shall live alone. His dwelling shall be outside the camp.
Gilbertus Anglicus described the grotesque appearance of a leper in the Middle Ages.
The eyebrows falling bare and getting knotted with uneven tuberosities, the nose and other features becoming thick, coarse, and lumpy, the face losing its mobility or play of expression, the raucous voice, the loss of sensibility in the hands, and the ultimate breakup of the leprous growths into foul running sores.
Those judged to be suffering from leprosy were banished to leper colonies where they used their own currency. Visitors breathed through cloths soaked in juniper to protect themselves, and lepers were required to sound rattles when approaching strangers. There was an early appreciation of a communicable disease, despite of the fact that many in the church believed leprosy to be a punishment for immoral behavior. Following is an image of lepers begging on a street in Jerusalem, accompanied by the regulations to which they were forced to obey.
I forbid you to ever enter churches, or into a market, or a mill, or a bakehouse, or into any assemblies of people. Also I forbid you ever to wash your hands or even any of your belongings in spring or stream of water of any kind, and if you are thirsty you must drink water from your cup or some other vessel. Also I forbid you ever henceforth to go out without your leper's dress, that you may be recognized by others, and you must not go outside your house unshod. Also I charge you, if need require you to pass over some tollway through rough ground, or elsewhere, that you touch no posts or things whereby you cross, till you have first put on your gloves. Also I forbid you to touch infants or young folks, whosoever they may be, or to give to them or to others any of your possessions. Also I forbid you henceforth to eat or drink in any company except that of lepers. And know that when you die you will be buried in your own house, unless it be, by favor obtained beforehand, in the church.
It's striking that the infectious diseases I'm discussing are still with us today, but they aren't of great concern since most are easily treated and prevented. Unfortunately, that was not always the case, so they caused the suffering and death of millions all over the world. As you look at a picture of French King Louis XIV, I'll list some of the past influential and powerful who fell victim to the next disease I'll be discussing, syphilis. The list includes some of our greatest explorers: Christopher Columbus, Captain James Cook, musicians Franz Schubert and Ludwig van Beethoven, artists Paul Gauguin and Francisco Goya, poets and writers John Keats, Johann Goethe, Charles Baudelaire, Alexander Dumas, James Joyce, Oscar Wilde, Guy de Maupassant, philosophers Arthur Schopenhauer and Friedrich Nietzsche. There were kings and queens of England: King Henry VIII, French Queen Mary Tudor, King Louis XIV and Napoleon, and Russian King Ivan IV, Peter I, and Catherine II. There were 3 popes. The first was Alexander the Sixth. His successor was Julius II, and his successor was Leo X. By way of introduction, syphilis is caused by the bacterium Treponema pallidum. The very name venereal disease meant a disease of Venus, giving the condition a divine origin with religious connotations. In a 16th century poem by Fracastoro, Apollo punished the shepherd Syphilis with this disease for his pagan beliefs. Incidentally, Fracastoro was the first to clearly define infections as a spread of disease by living organisms rather than by spontaneous generation, a century before the invention of the microscope. Congenital syphilis carries with it a high mortality rate along with damage to the nervous system, liver, eyes, ears, and bones. Briefly, the 4 stages of adult syphilis include primary, a chancre or a sore a month or 2 after exposure. Secondary, weeks or months later, a rash, fever with swollen lymph nodes. Latent, years or decades later with no visible signs. Tertiary, the most dangerous when decades later nervous and cardiovascular system damage can take place. The origin of the disease is unclear, but the earliest recorded account was in 1494 when French King Charles VIII sent his army to Naples, Italy. The Italians called it the French disease, while the French called it the disease of Naples. In 1519, Ulrich von Hutten proposed his own theory.
The physicians have not yet certainly discovered the secret cause of this disease, although they have long and diligently inquired after the same. In this all agree, which is very evident, that through some very unwholesome blasts of the air, which happened about that time, the lakes, fountains, and even the waters of the sea were corrupted, and the earth for a large tract, as it were poisoned thereby the pastures were infected and venomous streams filled the whole air, which living creatures took in with their breath, for this distemper at first was found among the cattle as well as among men. The astrologers deriving the cause from the stars said that it proceeded from the conjunction of Saturn and Mars which happened not long before, and of 2 eclipses of the sun affirming, that hence they perceived were like to ensue many choleric as well as phlegmatic distempers, which would long continue, and slowly depart, such as elephantiasis, lepra, impetigo, and all kinds of scabs and boils.
15th century astrologer Joseph Grunpeck added his theory and description of this terrible disease.
I have seen scourges, horrible sicknesses, and many infirmities affect mankind from all corners of the earth. Amongst them has crept in, from the western shores of Gaul, a disease which is so cruel, so distressing, so appalling, that until now nothing so horrifying, nothing more terrible or disgusting, has ever been known on this earth.
John Astruc was the physician to French King Louis XIV, and his objection to contemporary theories of contagion is now laughable.
There are some, however, whom I forbear now to spend time in imputing, such as Augustus Hauptmann and Christian Languus, who think that the venereal poison is nothing else but numerous school of little nimble, brisk invisible living things, of a very prolific nature, which when once admitted, increase, and multiply in abundance, which lead frequent colonies to different parts of the body and inflame, erode, and exulcerate the parts they fix on, in short, which without any regard had to the particular quality of any humour, occasion all the symptoms that occur in the venereal disease. But as these are mere visionary imaginations, unsupported by any authority, they do not require any argument to invalidate them if it was once admitted, that the venereal disease could be produced by invisible living things swimming in the blood. One might with equal reason allege the same thing, not only of the plague, as Athanasius Kircher the Jesuit and John Sagans lately have done, but also in the smallpox, hydrophobia, itch, tetters, and other contagious diseases, and indeed of all distempers whatsoever. And thus the whole theory of medicine would fall to the ground, as nothing could be said to prove the venereal disease depending upon little things, which might not be urged to prove that all other diseases were derived from the like little living things though of a different species, than which nothing can be more absurd.
All were aware of the dangers of syphilis. 16th century Italian physician Girolamo Fracastoro gave this warning to all.
Oh, how many patients, sorrowful victims of this plague, have contemplated with horror their faces and their bodies covered with hideous taints, deploring their youth in its bloom, and have cursed the gods and threatened the sky. Unfortunate, at all event, do not succumb to the attractions of love. Nothing could be more harmful, and your kisses would taint the tender daughters of Venus with a detestable contagion.
This is an image of a woman showing the rash of secondary syphilis, while Fracastoro supplies a description.
Those affected were sad, weary, and cast down. They were pale. Most of them had sores on the genital organs, ulcers similar to those which are wont to develop themselves on those organs after coition, and which are called caries, but of a very different nature. They were obstinate. When they were cured in one place, they appeared in another, and the treatment had to be recommenced. Afterwards, pustules arose on the skin, covered with a crust. In some they appeared upon the head, which was the most frequent place. In others they appeared elsewhere. At first they were small. Afterwards they increased to the size of an acorn, which they resembled in shape. In some cases these pustules were small and dry. In others they were large and moist. In some livid. In others whitish and rather pale. In others hard and reddish. They always broke in a few days and constantly discharged an incredible quantity of stinking matter as soon as open. They were so many true ulcers which destroyed not only the flesh, but even the bones. Those attacked in the upper parts of the body suffered from malignant affections which eat away sometimes the palate, sometimes the larynx, sometimes the tonsils. Some lost the lips, others the nose, others all the genital organs. Many had gummy tumors of the limbs which disfigured them and were often of the size of an egg. When they broke, a kind of white mucilaginous fluid flowed from them. They attacked chiefly the arms and legs. Sometimes they remained callous until death. But, as if all this were not sufficient, there ensued, moreover, severe pains in the limbs, often at the same time with the pustules, sometimes before, sometimes after them. These pains, which were persistent and unbearable, were chiefly felt in the night and were seated in the limbs themselves and in the nerves, rather than in the joints. Some, however, had pustules without the pains, others pains without the pustules. Most had both pustules and pains. However, all the limbs were in a languid condition. The patients were wan and emaciated, without appetite, sleepless, always melancholy and ill-humored, and anxious to remain in bed. Their faces and legs swelled and a slow fever sometimes supervened. Some suffered pains in the head which were persistent and did not yield to any remedy. If blood was drawn, it was found to be pure and somewhat mucus. The urine was thick and red. By this sign alone, supervening in the absence of fever, the disease might be recognized. The stools were liquid and mucus. A circumstance which has astonished everybody is the falling off of the hair of the head and other parts of the body, which produces a ridiculous appearance. Some have no beard, some no eyebrows, some are bald. At first these results were attributed to the remedies, especially to mercury. Now it is still worse. In many the teeth become loose, and in many they even fall out.
Following is a medieval image of one doctor treating a patient with syphilis, while another makes the diagnosis by examining the urine, a process called uroscopy that was carried out for centuries. Accompanying the image is a warning by theologian and knight Ulrich von Hutten.
In women the disease wreaks death in their secret places wherein are little pretty sores full of venomous poison, being very dangerous for such as unknowingly meddle with them, the which sickness, when contracted from these infected women, is so much the more grievous by how much they are much more inwardly corrupted and polluted therewith. After this there will appear small holes and sores, turning cankerous and fistulous, which, the more putrid they grow, the more they will eat into the bones, and when they have been long corrupted the sick grows lean, his flesh wasting away, so that there remaineth only the skin as a cover for them. And by this many fall into consumptions, having their inward parts corrupted.
I mentioned that probably the most dangerous phase is tertiary syphilis, when there may be damage to the cardiovascular and nervous systems. 18th century Italian physician Johannes Lanchisi gave an account of an aortic aneurysm.
His Eminence Cardinal Albani, now happily reigning as Pontifex Maximus, our most clement Pope, had as controller of his footmen a man named Plinio, healthy and strong, aged about 45, of square and stocky build. Now since a rumor of this had been wafted to the ears of that most eminent cardinal, he, with his usual innate and remarkable benevolence, urged me to examine the man. I therefore met in consultation 2 surgeons, one of whom gave the opinion that the disease was a deep-seated abscess, the other that it was an aneurysm buried deep in the aorta. And since I myself had noticed that the pulsation corresponded with the heartbeats and by its great pressure was driving the ribs outward, I did not hesitate to confirm at once the opinion of the surgeon who asserted that a genuine aneurysm of great size was concealed in the arch of the aorta. In fact, in the space of a few months, when the fluids also had been vitiated, his condition reached the point where no medicine gave any relief, but the ribs were eroded and pushed up till the spine was almost gibbous. Moreover, a stretching and tearing pain extended as far as the shoulders. It was then that an extremely rash empirical quack, arguing from the fact that the violence of the pulsation had decreased and supposing that it was a buried abscess that lay concealed, without the knowledge of the wretched patient's friends and relatives, persuaded him to let himself be cut open at the spot, and promised for certain that the pus enclosed within would at once burst forth and the man would be snatched from the jaws of impending death. The time came for the terrible deed, but alas, to our grief, the stream of blood that was kept in bounds by the very weak wall of its thin covering, when that wall was cut through by that unskilful and cruel knife, at once burst out of its bed with such speed that it snatched away with it the soul from the body. So to the great terror of the empiric and as a warning to surgeons, the unhappy patient fell lifeless, the victim of a barbarous carelessness.
The differential diagnosis of an aortic aneurysm versus an abscess was a difficult one since both appeared the same. With ultrasonic guidance, it's now an easy diagnosis, but in the past, a life and death decision had to be made since lancing an abscess was life-saving, while entering an aortic aneurysm was often fatal. Oliver Wendell Holmes was one of the greatest modern physicians, and he recognized the gravity of that diagnostic dilemma.
Sooner or later, everybody is tripped up in forming a diagnosis. I saw Velpo tie one of the carotid arteries for a supposed aneurysm, which was only a harmless tumor, and killed the patient. Mr. Dease of Dublin was more fortunate in a case which he boldly declared an abscess, while others thought it an aneurysm. He thrust a lancet into it and proved himself in the right. Soon after, he made a similar diagnosis. He thrust in his lancet as before, and outgushed the patient's blood and his life with it. The next morning, Mr. Duss was found dead and floating in his own blood. He had divided the femoral artery. Be very careful, be very slow, be very modest in the presence of nature.
The only effective treatment for syphilis was the use of mercury. The risks were great, and many preferred having the disease rather than the treatment. Following is a description by Ulrich von Hutten.
The patient was shut up in a hot room which was steadily and most vigorously heated, some for 20 days, some for 30, some for more. They anointed him and placed him on a bed laid in the hot room, and with many covers over him forced him to sweat. The patient, after being anointed barely the second time, began to grow weak in remarkable fashion. Such was the violent effect of the ointment that it forced the disease which had been on the surface of the body into the stomach. Thence it rose to the brain, and thence flowed through the throat and mouth to such an extent and with such violent injury that the teeth fell out in the case of those who had not cared well for their mouths. At the least in all cases the throat, tongue, and palate were ulcerated, the guts swelled, the teeth were loosened, sputum flowed without intermission through the lips with more stench than that of any foul matter, and with such power of contagion that whatever it touched it immediately befouled and contaminated, whence the lips so touched contracted sores and the cheeks inside were infected. The whole house round about stunk, and this type of treatment was so hard that many preferred to die of the disease rather than be cured in this way. I have seen many perish in the midst of the treatment, and I knew a certain man practicing this method who wretchedly murdered 3 farmers whom he had shut up in an overheated hot room, and who in their eagerness for the health which they had hoped they would get stood it more patiently than they should have, until their hearts failed to such an extent through the violence of the heat that they did not know they were dying. I have seen others suffocate when their throats swelled so up to their jaws that there was no way out, first for the poison which should have been thrown off in sputum, and then even for the breath itself. Some I have seen die because they could not urinate. Altogether a few recovered, and these with such danger, such suffering, such misfortunes.
The next topic is an ancient communicable disease, primarily of the respiratory tract, that took the lives of countless millions throughout history. Mycobacterium tuberculosis was called consumption because the disease consumed its victims, leaving them weakened and pale before taking their lives. There is evidence of its presence as early as 5000 BC in Heidelberg and in the bones of Egyptian mummies. 17th century British physician Thomas Sydenham is sometimes referred to as the English Hippocrates, and is considered by many to be the first great physician because of his bedside manner and his detailed classification of diseases. This is his description of tuberculosis.
The cough betrays itself, the phthisis comes in between the 18th and 35th years. The whole body becomes emaciated. There is a troublesome, hectic cough which is increased by taking food and which is distinguished by the quickness of the pulse and the redness of the cheeks. The matter spit up by the cough is bloody or purulent. When burnt it smells fetid. When thrown into water it sinks. Night sweats supervene. At length the cheeks grow hard, the face pale, the nose sharp. The temples sink, the nails curve inward, the hair falls off, there is colloquative diarrhea, the forerunner of death.
Though primarily introduced by way of the respiratory tract, the disease sometimes spreads through the bloodstream to the spinal column, where it is referred to as Pott's disease, first described in the 18th century by Percival Pott. The architecture of the vertebral bodies erodes, eventually leading to collapse and death from respiratory failure. On occasion, tuberculosis also presented as enlarged draining lymph nodes in the neck, that syndrome called scrofula after swine that were supposedly afflicted with the same disease. Another commonly used early term for this presentation was the king's evil, and those infected were purportedly cured by a king when he touched them with a newly minted gold coin bearing an image of an angel. That coin was then worn around the neck as a sign of healing and for future protection. The first to perform the king's touch was Clovis in France in 1494, though it was Edward the Confessor who established the tradition in 1045. Here you see above one of those gold coins circa 1670 from King Henry II, and below it a touch pass, which was a similar coin that was carried by visitors to the king's touch. Following is an image of French King Henry IV as he administers the royal touch to a kneeling man, while you hear a doctor refer to scrofula in Shakespeare's Macbeth, Act 4, Scene 3.
Malcolm, comes the king forth, I pray you. Doctor, sir. There are a crew of wretched souls that stay his cure. Their malady convinces the greatest essay of art, but at his touch, such sanctity hath heaven given his hand. They presently amend. Malcolm, thank you, doctor. Doctor exits, Macduff, what's the disease he means? Malcolm, 'tis called the evil, a most miraculous work in this good king which often since my here remain in England, I have seen him do. How he solicits heaven, himself best knows, but strangely visited people, all swollen and ulcerous, pitiful to the eye, the mere despair of surgery, he cures, hanging a golden stamp around their necks, put on with holy prayers, and 'tis spoken, to the succeeding royalty he leaves the healing benediction.
Despite the tradition having no merit, King Charles II touched more than 6,000 sufferers in 1660 and a total of 90,000 during his reign. Following is a description of the ceremony witnessed by writer John Evelyn in 1660.
The 6th of July, 1660. His Majesty began first to touch for ye evil, according to custom, thus, His Majesty sitting under his state in ye banqueting house. The surgeons cause the sick to be brought all led up to the throne, where they kneeling, ye king strokes their faces or cheeks with both his hands at once, at which instant a chaplain in his formalities says, he put his hands upon them and he healed them. This is said to every one in particular. When they have been all touched they come up again in the same order, and the other chaplain kneeling, and having angel gold strung on a white ribbon on his arm, delivers them one by one to his Majesty, who puts them about the necks of the touched as they pass, whilst the first chaplain repeats, that is ye true light who came into ye world. Then follows an epistle, as at first a gospel, with the liturgy, prayers for the sick, with some alteration, lastly, ye blessing, and then the low chamberlain and controller of the household bring a basin, ewer and towel, for his Majesty to wash.
Richard Wiseman was a 17th century physician and the personal surgeon to King Charles II. Following is a very convincing testimonial.
I myself have been a frequent eyewitness of many hundreds of cures, performed by His Majesty's touch alone, without any assistance of surgery, and those, many of them, such as had tired out the endeavours of able surgeons before they came thither. I must needs profess that what I write will do little more than show the weakness of our ability when compared with His Majesty's, who cureth more in any 1 year than all the surgeons of London have done in an age.
Physicians tried everything to cure tuberculosis, including incantations, prayer, and any number of bizarre therapies. The following is what Nicholas Culpeper recommended in his 1659 book, School of Physic.
For a cough or consumption of the lungs, take a cock, and when you have killed him, pull off the feathers while he is hot, then presently cut him through the back with a sharp knife, pull out all the bowels, and wipe him clean with a cloth, break all the bones, and put him into an alembic, and distill him with a pottle of sack, and as much red cow's milk, so will you have an excellent spirit for a cough, or consumption of the lungs, if you take 3 or 4 spoonfuls of it in the morning fasting.
You are looking at a 1768 image of tuberculosis called Stern and Death. Since the disease was universal, it affected all, both personally and professionally, including some of the most important artists and writers. On that list were Henry David Thoreau, Robert Louis Stevenson, D.H. Lawrence, Johann von Goethe, Jean-Jacques Rousseau, Anton Chekhov, and John Keats. Keats wrote the following to his fiancée.
On the night I was taken ill when so violent a rush of blood came to my lung that I felt nearly suffocated. I assure you I felt it possible I might not survive, and at that moment thought of nothing but you.
Charles Dickens' character Little Blossom in David Copperfield was a victim of tuberculosis, while Emily Bronte succumbed to the disease at the age of only 30 along with 3 sisters and 1 brother. We get an insight into her condition from this quote by Linton Heathcliff in her great novel Wuthering Heights.
You inquire after my health. It is better, but while I remain cut off from all hope and doomed to solitude, or the society of those who never did and never will like me, how can I be cheerful and well?
You are looking at an early portrait of the before and after effects of tuberculosis. Women were thought to be primarily disposed, and in fact some 19th century physicians believed that the disease was an aphrodisiac, while ironically many partners found the effects of tuberculosis to be an erotic stimulant. Prominent operatic figures suffered from tuberculosis, including Mimi in Puccini's La Bohème, seen here along with Marguerite Gautier in Verdi's La Traviata. While syphilis is a bacterium that was referred to in the past as the Great Pox, we now know the virus variola as smallpox. Both diseases disfigured and caused the death of hundreds of millions for centuries all over the world. Please be aware that all of the infectious diseases I'm discussing remain active threats, perhaps with the exception of only this one because of successful immunization. The last reported case of smallpox was in 1977. The first to describe this disease was the great 10th century Persian physician Rhazes.
The eruption of the smallpox is preceded by a continued fever, pain in the back, itching in the nose, and terrors in sleep. These are the more peculiar symptoms of its approach, especially a pain in the back, with fever, then also a pricking which the patient feels all over his body, a fullness of the face which at times goes and comes, an inflamed color and vehement redness in both the cheeks, a redness of both the eyes, a heaviness of the whole body, great uneasiness the symptoms of which are stretching and yawning, a pain in the throat and chest with a slight difficulty in breathing and cough, a dryness of the mouth, thick spittle and hoarseness of the voice, pain and heaviness of the head, inquietude, distress of mind, nausea and anxiety.
The rapid conquest of the Aztecs in Mexico by Hernando Cortez in the early 16th century was in large part due to the smallpox that he and his men had imported. They exposed an unprotected population, causing the death of over 18 million. The religious indigenous in Peru and Mexico vanished quickly as the natives converted to Christianity, believing that Cortez's God had favored the Spanish visitors. Members of the ruling classes across the sea, however, were not all immune, since smallpox affected Roman Emperor Marcus Aurelius, Kings Charles IX, Louis XIV, Louis XV, William II of Orange, Emperor Joseph I of Germany, and Peter II, Emperor of Russia. In 1848, British historian Thomas Macaulay described the death of 32-year-old British Queen Mary II from smallpox.
Smallpox was always present, filling the churchyards with corpses, tormenting with constant fears all whom it had not yet stricken, leaving on those whose lives it spared the hideous traces of its power, turning the babe into a changeling at which the mother shuddered, and making the eyes and cheeks of the betrothed maiden objects of horror to the lover. Towards the end of 1694 this pestilence was more than usually severe. At length the infection spread to the palace and reached the young and blooming queen. She received the intimation of her danger with true greatness of soul.
The variola virus became the first reported agent to be used in biological warfare. Lord Geoffrey Amherst, after whom the current Massachusetts City and College are named, assumed command of all English forces at the end of the French and Indian War. In the spring of 1763, Chief Pontiac of the Delawares surrounded the British settlement at Fort Pitt, now Pittsburgh, and demanded its surrender. There is evidence to suggest that Colonel Henry Bouquet, who led reinforcements to Fort Pitt, was instructed by Lord Amherst to give blankets infected with the smallpox virus to local Indian tribes. Following is an image of Colonel Bouquet dealing with his surrounding neighbors, accompanied by Amherst's inflammatory statements to Colonel Bouquet and to Sir William Johnson of the British Indian Department.
Could it not be contrived to send the smallpox among those disaffected tribes of Indians? We must on this occasion use every stratagem in our power to reduce them. Measures to be taken as would bring about the total extirpation of those Indian nations and put a most effectual stop to their very being.
The Chinese and the Indians had been immunizing themselves for centuries by inhaling ground-up smallpox scabs, while early Arabs scratched themselves with infected pustules, a process called variolation. It was well known that milkmaids who had been exposed to the udders of cows infected with cowpox were protected from smallpox. Lady Mary Wortley Montagu, wife of the British ambassador to Turkey, practiced the first Western inoculation in 1717 on a return from Turkey, where she had witnessed the prophylactic procedure well before Edward Jenner's important medical demonstration.
Apropos of distempers, I am going to tell you a thing that will make you wish yourself here. The smallpox, so fatal and so general amongst us, is here entirely harmless by the invention of ingrafting, which is the term they give it. There is a set of old women who make it their business to perform the operation every autumn in the month of September, when the great heat is abated. People send to one another to know if any of their family has a mind to have the smallpox. They make parties for this purpose, and when they are met, commonly 15 or 16 together, the old woman comes with a nutshell full of the matter of the best sort of smallpox, and asks what veins you please to be opened. She immediately rips open that you offer to her, with a large needle, which gives you no more pain than a common scratch, and puts into the vein as much matter as can lie upon the head of her needle, and after that, binds up a little wound with a hollow bit of shell, and in this manner opens 4 or 5 veins. The children or young patients play together the rest of the day and are in perfect health until the 8th day, then fever seizes them, and they keep their beds 2 days, very seldom 3. They have really about 20 or 30 pox on their faces, which never mark, and in 8 days' time they are as well as before their illness.
In May of 1796, Edward Jenner took the next important step when he removed infectious material from Sarah Nelms, a milkmaid who had been exposed to cowpox. On July 1st of that year, he inoculated the arm of James Phipps and subsequently was able to demonstrate that the boy had developed immunity, thereby making vaccination available to the masses. There was a great deal of opposition to vaccination, and unfortunately that resistance to immunization continues today. With no understanding of bacteriology or aseptic technique, secondary infection was common, most likely with streptococcus. Benjamin Franklin lost his young son to smallpox and never stopped regretting not having had him vaccinated. Abraham Lincoln had a mild case of smallpox while giving the Gettysburg Address, and on his return commented, "I finally have something I can give everybody." You will be looking at a famous Gilray etching of the supposed dangers of being inoculated by Jenner for smallpox as you listen to Phoebe Pember's account of her hospital experience while treating vaccinated Confederate soldiers.
They were dreadfully afflicted objects, many of them with sores so deep and thick upon arms and legs that amputation had to be resorted to save life. As fast as the eruption would be healed in one spot, it would break out in another, for the blood seemed entirely poisoned.
While you see some of the instruments used for vaccination in the 19th century, including ivory inoculation points on the left, similar to the ones used by Edward Jenner, you will be hearing Dr. Felix Oswald's inflammatory rhetoric taken from his 1901 book, Vaccination a Crime, which was recovered from the Boston Medical Library. Following that will be Dr. James Simpson commenting in 1847 on Jenner's monumental discovery.
Compulsory vaccination ranks with slavery and religious persecution as one of the most mischievous outrages upon the rights of the human race. Vaccination yields fees to lymph peddlers and baby slashers. The sophisms of the Jenner doctrine have been so thoroughly exploded that the persistency of its defenders seems to imply a moral rather than mental aberration. In other words, the collapse of all other supports justifies the suspicion of the hideous fact that the organization of the cowpox syndicate rests upon the deliberate sacrifice of truth to business considerations and corporation interests. Vaccination has become a crime.
During the long European wars connected with and following the French Revolution, it has been calculated that 5 or 6 million of human lives were lost. In Europe, vaccination has already preserved from death a greater number of human beings than were sacrificed during the course of these wars. The lancet of Jenner has saved far more human lives than the sword of Napoleon destroyed. On these devastating European wars, England lavished millions of money and freely bestowed honours, peerages, and heavy annual pensions upon the soldiers who were most successful in fighting their battles and destroying their fellow men. She grudgingly rewarded Jenner with £30,000 for saving 30,000 of her subjects annually.
Prior to the advent of antibiotics, and is caused by Clostridium tetani, was uniformly fatal. In his translation of Greek physician Aretaeus' work, Scottish historian Francis Adams clearly described the tragic nature of the disease, while at the same time he related the frustration encountered by early physicians who had nothing to offer their patients. Accompanying the description by Aretaeus is an 1847 illustration of tetanus by Charles Bell.
Tetanus, in all its varieties, is a spasm of an exceedingly painful nature, very swift to prove fatal, but neither easy to be removed. They are affections of the muscles and tendons about the jaws, but the illness is communicated to the whole frame, for all parts are affected sympathetically with the primary organs. Women are more disposed to tetanus than men, because they are of a cold temperament, but they more readily recover, whereas old men are most subject to the disease and most apt to die. The face is ruddy and of mixed colours, the eyes almost immovable, or are rolled about with difficulty, strong feeling of suffocation, respiration bad, distension of the arms and legs, subsultus of the muscles, the countenance variously distorted, the cheeks and lips tremulous, the jaw quivering, and the teeth rattling. Opisthotonos bends the patient backward, like a bow, so that the reflected head is lodged between the shoulder blades, the throat protrudes, the jaw sometimes gapes. Should the mischief then seize the chest and the respiratory organs, it readily frees the patient from life, a blessing this, to himself, as being a deliverance from pains, distortion, and deformity. The patient is not only bent up into an arch, but rolled together like a ball, so that the head rests upon the knees, while the legs and back are bent forwards, so as to convey the impression of the articulation of the knee being dislocated backwards. An inhuman calamity, an unseemly sight, a spectacle painful to the beholder, an incurable malady, owing to the distortion not to be recognized by the dearest friends, and hence the prayer of the spectators, which formerly would have been reckoned not pious, now becomes good, that the patient may depart from life, as being a deliverance from the pains and unseemly evils attendant on it. But neither can the physician, though present and looking on, furnish any assistance, as regards life, relief from pain or from deformity. For, if he should wish to straighten the limbs, he can only do so by cutting and breaking those of a living man. With them, then, who are overpowered by this disease, he can merely sympathize. This is the great misfortune of the physician.
All diseases affecting children are tragic, but to me the most devastating is diphtheria caused by the bacterium Corynebacterium diphtheria. For centuries there was no treatment or prevention, and the suffering is heartbreaking. Here, 2nd century Greek physician Aretaeus describes the disease accompanied by the 1910 watercolor entitled Diphtheria Trying to Strangle a Small Child by Richard Tennant Cooper.
Ulcers occur on the tonsils, some, indeed, of an ordinary nature, mild and innocuous, but others of an unusual kind, pestilential and fatal, but such as are broad, hollow, foul, and covered with a white, livid, or black concretion, and small pustules form, at first few in number, but others coming out, they coalesce, and a broad ulcer is produced. And if the disease spread outwardly to the mouth, and reach the uvula and divide it asunder, and if it extend to the tongue, the gums, and the alveoli, the teeth also become loosened and black, and the inflammation seizes the neck, and these die within a few days from the inflammation, fever, fetid smell, and want of food. But, if it spread to the thorax by the windpipe, it occasions death by suffocation within the space of a day. For the lungs and heart can neither endure such smells, nor ulcerations, nor ichorous discharges, but coughs and dyspnoea supervene. The manner of death is most piteous, pain sharp and hot as from carbuncle, respiration bad, for their breath smells strongly of putrefaction, as they constantly inhale the same again into their chest. They are in so loathsome a state that they cannot endure the smell of themselves. Countenance pale or livid, fever acute, thirst as if from fire, and yet they do not desire to drink for fear of the pains it would occasion, for they become sick if it compress the tonsils, or if it return by the nostrils, and if they lie down they rise up again as not being able to endure the recumbent position, and if they rise up, they are forced in their distress to lie down again. They mostly walk about erect, for in their inability to obtain relief they flee from rest, as if wishing to dispel one pain by another. Inspiration large, as desiring cold air for the purpose of refrigeration, but expiration small, for the ulceration, as if produced by burning, is inflamed by the heat of the respiration. Hoarseness, loss of speech supervene, and these symptoms hurry on from bad to worse, until suddenly falling to the ground they expire.
Dr. James Herrick practiced medicine in Chicago in the late 19th century. At one time, all physicians have that unforgettable, touching experience, and this was his. Accompanying that story is a picture of 2 O'Dwyer tracheotomy sets that might have been life-saving to children suffering from diphtheria prior to the advent of immunization and antibiotics.
In the case of an attractive 7-year-old child in whom the disease had invaded the larynx, I had inserted an O'Dwyer intubation tube. This gave relief for several hours. Then it was evident that the tube was becoming clogged. The parents begged me not to let the child strangle. I explained the desperate nature of the trouble, the extreme weakness of the circulation due to the toxemia, and the danger of even mild manipulative treatment. They understood. The mother left the room, the father took the child in his arms, and with little difficulty the tube was removed. As the father uttered a thank God, the child gave a feeble gasp and was gone. In memory, I can still see the room, the exact location of the bed, the chair, the limp child in the father's lap, the adjustment of the light.
There are many deadly infectious diseases I could have talked about, but I chose the ones I did because they allowed me to share them with you through the words and images of those there at the time. Sadly, we now have to deal with the loss of family and friends to infectious diseases of our own, not known then, but will be written and talked about in the future, like AIDS and COVID, hopefully after they have been eradicated. Thanks for joining me, and I'll see you next time.